My name is Kelsey Moon. I'm a student nurse at the College of Nursing, and today I'll be performing my NG tube insertion checkoff. So I'll start by first verifying my order in my hospital policy. I then perform hand hygiene. I will now identify my patient using two identifiers and check for any additional allergies. So we have Jaguar Jones, pairing with the armband, Jaguar Jones, medical record number 4176352, 4176352. So I have noted on both the patient's armband and the medical record that he's allergic to penicillin. So Mr. Jones, do you have any other additional allergies other than the ones noted on your chart? No. So from here, I would explain the procedure to my patient. So Mr. Jones, today I'll be inserting an NG tube. From at this point, I would gather all my equipment needed for the procedure and will don a pair of goggles. I would then perform hand hygiene again, raise the bed to a comfortable height, lower the side rails, and assess my patient's vital signs, oxygen saturation, and bowel sounds. I would stop NG tube insertion if the patient has a decrease in oxygen saturation or deterioration in vital signs. So I would then elevate the head of the bed to high Fowler's position and establish a queuing sign with my patient. So Mr. Jones, we're going to establish a queuing sign in case you need me to stop at any point in the procedure. So you can just lift your hand up if you're uncomfortable and need to stop. So I'm now going to open my NG tube package. I'll place a dollop of water-soluble lubricant onto the inside portion of my package. So at this point, I would prepare tape, which I've already done prior to the video. And so this tape will be used for marking the NG tube measurement, temporarily securing the tube, final fixation, and labeling. So normally I would be using a 60 milliliter syringe, but I did not have that available, so we'll be using a smaller one for today. So I'll pull out my syringe and we'll loosen up what would be the 60 milliliter syringe. And we'll then don a pair of clean gloves. I will now assess and select my patient's snare by having them close one nostril and breathe, and do this on both sides. So at this point, I would wash the bridge of the nose, either with soap and water or alcohol prep pad, which is what we're using today. So clean the tip of the nose and pat dry as needed. So from at this point, I would measure my NG tube, and there will be a separate video of me doing this on a volunteer for you to accurately be able to see. But you would place it, you measure it by going from the nose to the earlobe down to the xiphoid process. And when on a real person, you would not measure over any clothing, and then you would mark that place with a piece of tape. So for right now, we will just take a prepared piece of tape and place it onto our tube in order for us to know how far to insert it. So from at this point, I would place a towel over my patient's chest and we'll place a basin on their abdomen to hold the end of my NG tube and possible emesis. So I would first lube about the first 4 inches of my tube with my water-soluble lubricant. And from this point, I would ask my patient to extend their head back against their pillow and would then insert the tube through my selected nearest with my curved end pointing downward. Insert. So once beyond the nasopharynx, I would have my patient relax, then flex their head forward, and would have my patient sip on some water throughout the procedure. And if they're not able to have any water, have them dry swallow as I advance the tube about 1 to 2 inches at a time and rotating the tube gently about 180 degrees. So be sure to not force the tube or push against resistance. So if the patient starts to cough, has a drop in O2 saturation, or shows any other signs of respiratory distress, I would withdraw the tube into the posterior nasopharynx until normal breathing resumes and instruct the patient to swallow again before advancing the tube. So we'll insert this all the way down to our piece of tape where we measured, and would then secure the tube to my patient's either their nose or their cheek. From this point, I would then check the position of the tube in the back of the throat using either my pen light and tongue blade. And from this point, I would then connect what would be my 60 milliliter syringe to the end of my NG tube. I would assess the correct placement of the tube by aspirating gastric contents, assessing pH if indicated, and have x-rays performed if ordered. So I'll now remove the temporary tape and secure the tube to the nose with skin prep and tape. So we'll take off our temporary one. We'll gather our skin prep and secure that with tape. Securing that to the nose. So I would then clip the NG tube to my patient's gown, allowing for slack for them to be able to turn their head accordingly and make sure that it's all according to the hospital policy. So I note the exit site by marking on the tube with an indelible marker as a guide for any tube displacement. So at this point, I would attach to the tube to the Salem sump and would adjust the suction to low wall intermittent suctioning as ordered. So if it's not in use, I would make sure to cap it. So from this point, I would make sure the blue pigtail of the Salem sump is placed above the patient's stomach. So typically I'll just kind of place it above my patient's head and let it rest right there on what would be their shoulder. I would then place the head of the bed no lower than 30 degrees, raise the side rails, lower the bed, and assess for patient comfort, making sure that they have the call light in reach. So I then document the type and size of NG tube, time, location, how I secured it, how placement was verified, suction, and patient tolerance. I would also document the color, amount, and characteristics of secretions. So to discontinue the NG tube, I would first check the order. Perform hand hygiene and explain the procedure to the patient of discontinuing the NG tube. So I would then don a pair of clean gloves. And from this point, I would then auscultate vowel sounds, make sure to turn off my suction, remove my tape from my nose, and clip from the gown, and ask my patient to take a deep breath and hold it. So from this point, I would kind of kink the NG tube back on itself and pull my tubing out. So after removing, I would measure drainage, perform oral hygiene, and document. And that completes my NG tube insertion checkoff.